Welcome to Enol Health Facts. Hi, my name is Dr. Hussain. Today's topic is on exercise prescription and writing. Today's video is only introductory video. Actually, we are going to launch a series of videos for different disorders and their exercise prescription and writing. Exercise is one of the most underutilized treatment option in modern healthcare, which places an emphasis on medications and procedures. The benefits of exercise have been researched and documented by many groups and agencies over the past 3 decades and have issued landmark publications on physical activity and health. An exercise program that includes aerobic exercise, resistance training, flexibility, and neuromotor training is indispensable to improve and maintain physical fitness and health. Despite this, physical inactivity has been cited as one of the greatest public health threats of the 21st century. Knowledge of the tremendous clinical benefits of exercise should not be denied to any patient, especially patients at risk for or with chronic diseases. In fact, physical activity should be considered part of the management plan for every patient unless exercise has been deemed unsafe for them due to a serious underlying condition. For patients at risk for chronic diseases, physical activity could be considered a vaccine that greatly lowers the risk of disease and improves quality of life. More emphasis should be placed by healthcare providers on implementing physical activity as a therapy for prevention and treatment rather than the countless drug therapies. Unfortunately, the healthcare system focuses on procedures and pharmaceuticals while seemingly ignoring prevention and treatment. As healthcare evolves into a system that both demands and rewards preventive care, the focus on exercise should increase accordingly. Exercise has shown tremendous benefits on different disorders. It has been shown benefit on cardiovascular and respiratory function. It has decreases morbidity and mortality. Even exercise has decreased anxiety and depression and also reduces pain. It improves cognitive function. It enhances physical function and independent living in older individuals. It enhances feelings of well-being. It reduces risk of falls in older individuals. It prevent or mitigate functional limitations in older adults. Exercise and physical activity are often overlooked as therapeutic treatment options. Additionally, prescribing exercise may be challenging as many patients are looking for an easy fix. When appropriately utilized, exercise can be an effective long-term treatment for many conditions. Safe and effective exercise prescription requires careful consideration for the target individual's health status, baseline fitness, goals, and preferences. Exercise prescription is based on 5 principles: type, duration, frequency, intensity, and volume. Pattern of physical activity vary with demographic characteristics. It includes sex, race, age, annual income, and education. For example, it has been shown that women reported higher inactivity than men. Recommendations. Recommendation for adults include at least 150 minutes a week of moderate intensity aerobic activity or 75 minutes a week of vigorous intensity aerobic activity or an equivalent combination of the two. Moderate intensity activity, what it is? Actually, moderate intensity is defined as 3 to 5.9 metabolic equivalents, which is called METs, METS, and 45 to 63% of VO2 max, or in terms of maximum heart rate the maximum heart rate for moderate intensity is 64 to 91% of maximum heart rate. For vigorous intensity, we defined it as 6.0 METs METs, which is metabolic equivalence, and in terms of VO2 max in vigorous intensity, it should be 64 to 91%, and maximum heart rate should be 77 to 93%. There is another method of exercise prescription which is outlined by the McGill. It takes 5-stage progression of training. First stage, it involves detection and remedy of incorrect motor patterns. In second stage, it establishes stability of joints throughout the whole body via exercise and education with a focus on spine stability. In stage 3, it develops endurance and applying prior skills to daily activities, and stage 4 and 5 are for athletes and includes training, strength, speed, power and agility. Kindly and hope you have liked the video. Please subscribe it, like it, so that you will get the update of the coming video, and we will the next videos will be for disorders and the prescription of the exercise. For example, in exercise prescription in cardiovascular diseases, exercise prescription for pulmonary respiratory disorders, exercise prescription for cancer, exercise prescription for old ages, and exercise prescription for osteoarthritis, exercise prescription for stroke patients, and number of other disorders. Thank you very much. All the